So hello बच्चों and welcome once again to this series of lectures. हमने brachial plexus देखा है पिछले लेक्चर में. Let us understand the lesions of the brachial plexus. हाँ, तो brachial plexus आपने समझ लिया है कैसे फॉर्म होता है, where it lies, its relation to the axillary arteries, सब आपने देख लिया. Branches of brachial plexus आपने देख लिया. We understand now the injuries of the brachial plexus, the lesions of the brachial plexus. That's a very important topic. शॉर्ट नोट्स आते हैं, एमसीक्यूज भी आते हैं, वाइवास में पूछते हैं. चलो, लेट अस अंडरस्टैंड द लीजन्स ऑफ द ब्रेकियल प्लेक्सस. नाउ द फर्स्ट लीजन ऑफ ब्रेकियल प्लेक्सस, दो लीजन्स है बेसिकली. देयर आर टू लीजन्स ऑफ द ब्रेकियल प्लेक्सस. वन इज Erb's paralysis, and second is Klumpke's paralysis. ठीक है. So Erb's paralysis and Klumpke's paralysis, what is the difference in both of them? Basic difference क्या है? Basic difference, look, this is C5C6 roots. What is this? Upper trunk. याद है upper trunk से there are two nerves which arise here, the suprascapular and the nerve to subclavius, right? Upper trunk of brachial plexus आपको पता है ना अच्छे से. From the upper trunk, two nerves arise. One is the suprascapular nerve, the other one is nerve to subclavius. अब ये जो point है, this point on the upper trunk is known as the Erb's point. So what is Erb's point? Erb's point is a point on the upper trunk of brachial plexus. ठीक है. जहां पे ये दो nerves arise होते हैं, suprascapular and nerve to subclavius. Injury to the Erb's point leads to Erb's paralysis. हाँ, तो ये basic चीज है. Let this be clear. So that's Erb's paralysis. So what is Klumpke's paralysis? Klumpke's paralysis, this is C8 and T1 root. And C8 and T1 से बनता है, what is this? Lower trunk, right? That's the lower trunk. So injury to the lower trunk results in Klumpke's paralysis. तो ये है upper trunk. This is the upper trunk of the brachial plexus. And that's a lower trunk. So basic difference clear है. Erb's paralysis and Klumpke's paralysis में, Erb's paralysis is injury to the upper trunk at the Erb's point. Klumpke's paralysis is injury to the lower trunk of the brachial plexus. Fine. अब what are the reasons for this? Reasons क्या होंगे? एक तो Erb's paralysis में क्या होता है ना, upper trunk injuries कभी होते हैं when there's a separation of head from the shoulder. ये shoulder है, ये head है, so there's stretching here. ऐसे stretch हो जाता है, stretch. So यहाँ पे pressure आ जाता है, the upper trunk gets injured. ये कब होता है? Accidents, road accidents में. A person is driving a bike चला रहा है, he meets with an accident and his head hits the divider. बीच में divider होता है, head hits the divider and there's a separation of head from the shoulder. जोर से यहाँ पे है ना pressure आ जाता है, injury to the upper trunk. During birth, when a child is being delivered, the child head is out and अब है ना the trunk is inside, मतलब ये uterus के अंदर है, the head is delivered and the gynecologist is pulling the child, मतलब ऐसे बच्चे को खींच रहे. So there's a separation of head from the shoulder. So this is birth injuries and this is trauma. Look, the head is separated from the shoulder. यहाँ पे pressure आ जाता है, that's injury to the upper trunk. Fine. Klumpke's paralysis कब होगा? Klumpke's paralysis कैसे बताऊं अभी आपको. एक person is falling down. समझो एक है ना छोटा बच्चा, he's gone on a tree. आम का पेड़ है, mango tree. A child climbs on the mango tree to take the mangoes and suddenly जहाँ पे वो खड़ा है, the bark on which he is standing breaks off. हाँ, वो टूट गया. The branch on which he is standing breaks off. अब वो नीचे आ रहा है, he's falling down, but suddenly he gets another branch. एक दूसरा branch आ गया, वो ऐसे पकड़ लेता है. He holds this branch. He doesn't fall down. वो नीचे नहीं गिरता because he holds with both the hands. या फिर एक हाथ से ऐसे पकड़ लेता है. So there's a jerk. यहाँ पे jerk बैठ गया. Lower trunk is involved. Lower trunk involvement होता है. This is Klumpke's paralysis. Okay. So what is this? Abduction at the shoulder joint. जोर से abduction होता है. That is known as hyperabduction injuries. समझ में आ रहा है? A person is falling down. Imagine करो, you're gone on a tree. You're plucking the mango. The branch breaks off. The person is falling down. The person holds something, gets a jerk. जोर से जोक बैठा, इंजरी टू द लोअर टंग, दैट्स क्लम्कीज पैरालिसिस. ठीक है, बोथ इंजरीज में भी होता है क्लम्कीज पैरालिसिस. सो मेन डिफरेंस क्लियर है आपको, व्हाट इज अब्स, व्हाट इज क्लम्कीज पैरालिसिस, अपर टंग लोअर टंग, एक्सीडेंट्स में होता है, इंजरीज में होता है, हाँ बोथ इंजरीज में होता है. ओके फाइन. सो अपर टंग. So let us start with Erb's paralysis. Erb's paralysis is injury to which? Upper trunk. Upper trunk, right? What is the root value of upper trunk? Dekho, this is C5, C6. That's the upper trunk. What is the root value of upper trunk? C5, C6. C5, C6. यहाँ से दो nerves भी आते हैं, suprascapular and nerve to subclavius. Now this C5, C6 is present in many nerves. वैसे तो बहुत सारे nerves में है C5, C6, but C5, C6 is mainly present in two nerves. Mainly present in axillary nerve, axillary and musculocutaneous nerve. Main concentration of C5, C6 होता है axillary nerve and musculocutaneous nerve. So axillary nerve का involvement होगा, musculocutaneous nerve will be involved, plus suprascapular nerve, suprascapular nerve and the nerve to subclavius. All these nerves will be involved. समझ में आया बच्चों? Look, C5, C6, upper tongue, this point is the Erb's point. यहाँ पे इंजरी होगी, Erb's paralysis. Which roots are involved? C5, C6. C5, C6 is mainly present in axillary nerve, musculocutaneous nerve, suprascapular and nerve to subclavius. बाकी nerves में भी होता है, but concentration is less. कम concentration होता है C5, C6 का. Okay, so now you have to know what is the axillary nerve supply. So look, I'll make it like this: nerve, muscles paralyzed, and उसके बाद is effects of lesion. Nerves, muscles paralyzed and effects of lesion. Effects of lesion. This is how you understand it, huh? So कौन से nerves involved होते हैं ये clear है? Nerves involved, huh? I'll write it here. Nerves involved. ये चार nerves involved है. So now we'll understand it like this. Which are the muscles paralyzed? And muscles paralyzed हो गए. So how is the position of the upper limb? How is the position of upper limb? चलो, you'll understand this. ये easy है. Understand this. So we'll start with axillary nerve. Nerve involved is axillary. Axillary nerve दो muscles को supply करता है. Number one is the deltoid. So deltoid is paralyzed. What is the action of deltoid? Action of deltoid is abduction, 15 to 90 degree. Main action क्या है? Abduction from 15 to 90 degrees. So abduction is lost. Abduction गया. So the arm is adducted. Understanding this? बच्चे, this is not the action. ये action नहीं है. This is the effect of paralysis. Paralyzed हो गया तो क्या हुआ? So deltoid is paralyzed. Action of deltoid abduction है. So abduction is lost. So the arm is adducted. Arm adducted position में. Second muscle is teres minor. Teres minor muscle is supplied by axillary nerve. Teres minor का action क्या है? चलो बोलो. Answer this. What is the action of teres minor? Lateral rotation. Lateral rotation at the shoulder joint. So lateral rotation गया. एक party weak हो गया तो दूसरा party becomes strong. So lateral rotation is lost. So the arm is medially rotated. समझ में आ रहा है? So arm is adducted and arm is medially rotated. So समझ में आ रहा है? Axillary nerve involvement है. Axillary nerve supplies deltoid and teres minor. ये paralyzed हो गए तो उसका effect क्या हुआ? These muscles are paralyzed. So what is the effect of this paralysis? So arm is adducted, arm is medially rotated, plus, hello. What else does the axillary nerve supply? Students, cutaneous supply, cutaneous. मैंने बोला है आपको. बच्चों ये पूरा thumbnail देख लो, पूरा playlist देख लो. Playlist, not thumbnail, playlist देख लो. Of the clinical case discussion. Clinical case discussion का एक playlist बना है. Just try to see that, try to understand that playlist. उसमें काफी चीजें clear हो जाएंगी. Which cutaneous supply is done by axillary nerve. Axillary nerve supplies the skin on the upper lateral aspect of the arm. Upper lateral aspect of the arm के skin को supply करती है. So there's a loss of sensations of the skin on the upper lateral aspect of the arm. इसे हम बोलते हैं regimen batch sign. Regimen batch sign. ठीक है, regimen batch sign. Are you able to follow this? So this is the lesion of involvement of axillary nerve. Axillary nerve involvement की वजह से this has happened. The second nerve involved is musculocutaneous nerve. Musculocutaneous nerve supplies what? Biceps and brachialis. Biceps and brachialis. So now you tell me, what is the main action of brachialis? Main action of brachialis क्या है? Okay, but I'll just write it here. This is easy. Musculocutaneous nerve supplies the biceps and brachialis. So what is the main action of brachialis? Main action of brachialis is flexion at the elbow joint. So flexion gaya, flexion is gone. So the forearm is extended. Forearm is extended. समझ में आ रहा है? Forearm is extended. What is the main action of biceps? Supination. Supination main action है. Supination is lost. So the forearm is pronated. Forearm is pronated. See, ठीक है, forearm is pronated. So how is the position of upper limb? देखो, position of upper limb कैसा है? Arm is adducted. Arm is medially rotated. Arm adduct हो गया. Arm medially rotated हो गया. Forearm is extended. The forearm is pronated. Forearm is extended. Forearm is pronated. Plus musculocutaneous nerve supplies the skin on the lateral aspect of forearm. So loss of sensations. Loss of sensations on lateral aspect of forearm. Lateral aspect of forearm. Loss of sensations on the lateral aspect of forearm. This is involvement of musculocutaneous nerve. समझ में आ रहा है बच्चों? So how is the position of upper limb? देखो, arm is adducted. ये adduct हो गया. Arm is medially rotated. Arm is adducted. Arm is medially rotated. Forearm is extended. Forearm is pronated. Forearm is extended. Forearm is pronated. जब ऐसे होता है तो finger becomes like this. Finger becomes like this. What do you call this as? This is what we call as the policeman's tip hand. Policeman's tip hand. ऐसे होता है, ऐसे policeman's tip hand. ठीक है? Understanding this? So clear है बच्चों? Erb's paralysis. Erb's paralysis is involvement of the upper trunk of brachial plexus. Erb's point होता है जहाँ पे it's a meeting place of 6 nerves. Main nerve involvement is axillary, musculocutaneous, suprascapular, and the nerve to subclavius. So axillary nerve involvement होता है तो deltoid is paralyzed, so the arm is adducted. Teres minor is paralyzed, arm is medially rotated, and thus a regimen batch sign. Musculocutaneous nerve, biceps is paralyzed, so arm is pronated. Brachialis is paralyzed, so forearm is extended. Forearm is pronated, forearm is extended, and there is a loss of sensations on the lateral aspect of forearm. This is Erb's paralysis. How is the position of upper limb? Arm is adducted, arm is medially rotated, forearm is extended, forearm is pronated, and there's a policeman's tip hand. Fine. और कौन से nerves involved है? Which are the other nerves involved? दूसरे nerves involvement is suprascapular nerve. Suprascapular nerve. ये क्या supply करता है? Supraspinatus and infraspinatus. Supraspinatus, infraspinatus. What is the action of supraspinatus? Abduction. Abduction है ना? Abduction from 0 to 15. So abduction is lost. So arm is adducted. Arm is adducted. ये already कौन कर चुका है? This already is done by deltoid. Arm is adducted. Infraspinatus का action is lateral rotation. So the arm is medially rotated. Medially rotated. ये already किसने किया है? This is already done by teres minor. सेम एक्शन है. डेल्टॉइड एंड टेरिस माइनर सेम एक्शन है. सुप्रास्पाइनेटस एंड इंफ्रास्पाइनेटस का. ठीक है. नर्व टू सबक्लेवियस नथिंग स्पेसिफिक, इट जस्ट स्टेडीज द क्लैविकल. क्लैविकल को स्टडी करता है. नर्व टू द सबक्लेवियस मसल. सो नथिंग स्पेसिफिक इन दैट. ठीक है बच्चों, ऐसे आपको लिखना है. वापस बोल रहा हूँ. सी अगेन आई एम टेलिंग यू दिस मसल्स आर पैरालाइज्ड एंड दिस इज द इफेक्ट ऑफ लीजन. ये नहीं तो आपको लगेगा ये एक्शन ऑफ मसल्स है. ये एक्शन ऑफ मसल्स नहीं है. दिस इज द इफेक्ट ऑफ पैरालिसिस. तो क्या एक्शन क्या होता है फोरआर्म का? फाइन, परफेक्ट. So that's about the Erb's paralysis. Now coming to the next, Klumpke's paralysis. Klumpke's paralysis Involvement of which trunk? Klumpke's paralysis. Involvement of lower trunk, C8T1. यह है lower trunk of the brachial plexus. Involvement of this trunk leads to Klumpke's paralysis. ये कब होता है? Hyperabduction injuries. Hyperabduction injuries. When the arm is hyperabducted. Like a person is skiing. एक और example देता हूँ. Skiing कर रहा है, ice में skiing कर रहा है, and बहुत speed में जा रहा है. He's going in a speed, and suddenly he gets something and he holds this. ऐसे ऐसे कुछ पोल आ गया बीच में, and he holds this and जोर से जर्क बैठता है, जोर से जर्क. These are hyperabduction injuries. Second, bird trauma. हाँ, bird trauma में भी होता है hyperabduction. Look at this. Look at this. इसे बोलते हैं hyperabduction injuries. During bird trauma, हाँ, like hand is pulled out, तो lower trunk को stretch होता है. Clear? So that is the cause of Klumpke's paralysis. Now, which roots are involved? C8T1. Now, this C8 and T1 is mainly present in median nerve, median and ulnar nerves. Median and ulnar nerves में होता है. This C8 and T1 is mainly present in median and ulnar nerves, which supply the intrinsic muscles of the hand. Intrinsic muscles of hand. ये जो छोटे छोटे मसल्स है ना, intrinsic muscles of the hand, this is mainly supplied by C8 and T1. And this C8 and T1 is present in median and ulnar nerves. Median and ulnar nerves. आपको पता है ulnar nerve supplies how many muscles in the hand? 15 muscles. Median nerve supplies how many muscles? 5 muscles in the hand. So ये सारे muscles paralyze हो जाते हैं because of involvement of median and ulnar nerve. The lower trunk C8 and T1 mainly supplies the intrinsic muscles of the hand. So what do we get? We get a claw hand. इसमें क्या मिलता है अपने को? Claw hand. We get a claw hand. This is involvement of T1. तो C8 and T1 होता है ना, C8 and T1 supplies the मतलब T1 mainly supplies the intrinsic muscles of the hand. C8 supplies the paralysis of ulnar flexors of the wrist. Ulnar flexors of the wrist. This is supplied by C8. मतलब C8 क्या सप्लाई करता है? Ulnar flexus of the wrist. Ulnar flexus of the wrist. Who's that? Flexor carpi ulnaris. Flexor carpi ulnaris है ना, which flexes the wrist joint. That is supplied by C8. एक बार वापस. Klumpke's paralysis, involvement of C8 and T1, lower trunk of the brachial plexus का involvement है. This C8 and T1 is mainly present in median and ulnar nerves, which supplies the intrinsic muscles of the hand, that is supplied by T1, and the ulnar flexors of the wrist and fingers. Ulnar flexors of the wrist and fingers. Ulnar flexors of the wrist and fingers. ये कौन है? Flexor carpi ulnaris and the flexor digitorum profundus. Flexor digitorum profundus. ये muscles आप बाद में देख लो, you'll understand this. हाँ, तो these two muscles are paralyzed. So what we get because of this? We get claw hand, and this paralysis of ulnar flexors of wrist and fingers. ये होता है Klumpke's paralysis में. Now Klumpke's paralysis में what else? See, this is claw hand. ये क्या है? Claw hand. That's claw hand. Okay. Now you tell me, Klumpke's paralysis, there's T1 involvement. And T1 gives rise to, carries, or I'll write T1 carries preganglionic fibers of sympathetic nervous system. So T1 में क्या होता है? T1 में preganglionic fibers of sympathetic nervous system होता है. So because of the involvement of T1, because of the involvement of sympathetic fibers, what we get? We get a Horner's syndrome. Horner's syndrome. Okay, now what is Horner's syndrome? ये क्या होता है? कैसे होता है? That we'll see later. But just याद रखना, in Klumpke's paralysis, what do we get? We get a claw hand, we get the paralysis of ulnar flexors of wrist and fingers, and because of involvement of T1 का involvement हो जाता है, T1 carries sympathetic fibers. Because of this we get a Horner syndrome. Horner syndrome is a group of diseases. इसमें loss of sweating होता है, anhidrosis, anophthalmos होता है, meiosis होता है. That is constriction of pupil. Constriction of pupil is meiosis. Loss of sweating, that's anhidrosis. ठीक है, फिर eyeball goes in anophthalmos. हाँ, ये कुछ चीजें हैं in Horner syndrome that we'll see later. ये अपन बाद में देखेंगे. But this is Klumpke's paralysis. Students, I hope this is clear to all of you. I hope this is clear to all of you. हाँ, ठीक है ना? तो आज हमने lesions of brachial plexus discuss किया. In that we have seen mainly the Erb's paralysis, upper trunk, Klumpke's paralysis, lower trunk. ठीक है, Erb's paralysis में which muscles are paralyzed, which nerves are involved, which muscles are paralyzed, and effects of lesion. What is Policeman step hand? ये हमने देखा. Klumpke's paralysis, involvement of lower trunk, C8T1, what it supplies, and the effect of paralysis. क्या होता है उससे? Claw hand. And ulnar flexus of wrist plus Horner syndrome क्यों होता है? Because T1 involvement है, T1 carries sympathetic fibers, so that is why Horner syndrome भी होता है. So बच्चों, I hope this is clear to all of you. The lesions of the brachial plexus बहुत important topic है. Short note आता है Erb's paralysis, Klumpke's paralysis में. Plus you get this in MCQs, in vivas. हाँ, ये सब में पूछते हैं. So ये कुछ basic चीजें हैं बच्चों. Basic चीजें clear कर लेना. Your concept has to be clear so that your foundation is very strong. Foundation strong होना चाहिए. तब जाके आप आगे exceed करोगे, right? So for this you see the complete playlist. पूरा playlist देखो. I have made a playlist for clinical case discussion, which is very difficult for the students. वो भी बना लिया. मैंने short topics भी आपके लिए बना लिए. I hope you are all happy and you are enjoying. Thank you from the entire team of Anatomy Unlimited. Thank you. See you once again in the next lecture. Bye-bye.